I'm Stacy Self. I'm the newborn screening coordinator for the Cystic Fibrosis Center at Children's. I work real closely with Dr. Hector Gutierrez and the CF team there. I appreciate having the opportunity to be here today, and I really appreciate all the stories that we're hearing from families. That's really, why we do what we do. I'll know to bring tissue next year. But anyway, just to tell you a little bit about CF newborn screening, and I'm going to have the honor of introducing the Mccain family in just a second. We started CF newborn screening in 2008, and we use the IRT DNA algorithm where the state lab looks for the IRT in babies, and then if that's elevated, goes to the DNA portion, and they use about a 46 panel mutation that they look for. Since we've started, we've diagnosed about 15 to 20 babies per year in the state of Alabama. We at Children's are the only accredited CF center in Alabama now, and so we try really hard to get all the babies to follow up at our center. I work very closely with Rachel Montgomery to make sure that all the babies are in to have their sweat test by at least 3 weeks of age. We're trying to get them in even a little bit quicker than that because of some recent recommendations. And so I want to take just a minute to introduce the Mccain family. I actually remember the day that I met this sweet family. They had their third son. His name is Jeremy, and he came to us as a positive newborn screen. And the McCains have 4 beautiful boys. You probably will see them running around somewhere. I've seen all of them today. And I can remember when we were telling them about Jeremy and doing a little bit of education that first day, they started asking some questions about one of their older sons. And their 2 oldest sons had been born prior to us starting newborn screening. And they were asking some questions and kind of feeling like, I think maybe one of our other sons might have this disease. And come to find out, Justin, who was 5 at the time, was also diagnosed with cystic fibrosis and just had been missed, had been born before newborn screening and had gone undiagnosed. Jake, their oldest son, does not have CF, and since then they have a 16-month-old who was also diagnosed through newborn screening. A little interesting with Joseph is that his initial newborn screening was normal. The IRT was normal initially, and it wasn't until that 2-week follow-up screen that the pediatricians do that the IRT was elevated and then was found to have 2 CF-causing mutations. And so that just reiterated the importance of that 2-week screen for us in the CF Center. So I just want to thank Jennifer for coming today and telling her story. I know you guys are going to really enjoy hearing what she has to share about kind of living day to day with cystic fibrosis.
Thank you so very much for letting me come and speak to you about my family, my precious family that I brought with me today. And like Stacy said, they're probably running the hallways saying, "Mom, let's go." I'm Jennifer McCain. I have 4 precious boys. Jake, our oldest, is 12. Justin is 10. Jeremy is 5. And Joseph is almost 17 months. Our story is basically through newborn screening, 2 of our 3 children were diagnosed with cystic fibrosis. Justin spent his first 5 years undiagnosed because he was born prior to CF newborn screening. Jeremy and Joseph were newborns when diagnosed. Newborn screening is so very important, and we are so grateful for it. Those are the 3 that do have CF. And you can't tell unless you do a sweat test, so they look healthy and normal and are gaining weight. This is our Justin, and this is a picture of him at age 5. This was before he was diagnosed with CF. He weighed 34 pounds, and I knew something was not quite right because he was smaller than his older brother and just had no idea what was ahead for us. This is Justin having his sweat test done on the day he actually was diagnosed with CF in 2010. This is Jake having his sweat test done in 2010. He was age 7. He's not even a carrier for cystic fibrosis. This is the boys at the CF clinic for their quarterly checkups at Children's. They have to mask up and wear gowns at clinic to prevent germs. This is also at clinic. Their vitals are checked, weights checked, throat cultures are done. The doctor examines them, and their lung function tests are done. And this is us at home. We have to use chest therapy machines twice a day for 30 minutes, and that helps keep their lungs clear from any mucus. And Joseph, the baby, I have to do his therapy by hand. He's not old enough to use a machine yet. And this is just our typical one-day supply of medicine for all 3 boys. The boys' meds, each of them take enzymes with every meal and every snack to help them digest their food properly. Justin and Jeremy are actually currently on Kalydeco. I don't know if you're aware of that wonderful drug. They're 2 of the 4% that are able to take Kalydeco, and it helps wipe away the symptoms of CF. So we're unbelievably blessed for that new drug. This is our family. We participate in our Blow Away 5K and 1 mile fun run in Trustful, and we'd love to have you. We're having one come up November 14th. That's our way to advocate and help raise money and awareness for support for research. And we also give back to Children's Hospital and UAB. So if you're interested, just look us up online at blowaway5k.com. We'd love to have your support. This is Justin. This was taken just probably a month ago. He now weighs 78 pounds. He's doing great. He loves dinosaurs, Legos, and playing with his brothers. This is Jeremy. He now weighs 43 pounds and is doing great. He loves dinosaurs, Legos, trains, and playing with his brothers. And this is Joseph, our baby. He now weighs 23 pounds, and he's doing great. And he loves eating his brother's Legos, trains, and dinosaurs, and he loves playing with his brothers. And that's our family. I really appreciate all of you and the work that you do for newborn screening. It's a blessing to be here today. My family's a blessing to me, and I thank each and every one of you. Thank you.